Hi everyone, my name is Daphna. Today we're going to be talking about our menstrual health and our cycle and our period, and we're going to explore all angles from it, the anatomy angle of exactly which kind of organs we have there and what are their functions and what are their role in our cycle. And then we're going to talk about emotional aspects, which are emotional patterns which are changing throughout the month. Afterwards, we're going to move on and discuss some postures and movements which will help us during that time of the month where we feel either PMS or that we have period pain that we need to process. And later on, we're going to finish talking about birth control options and hygiene options. So let's begin. The first thing that we're going to talk about is anatomy, and I have this really sweet doll that I've been using for years now because first of all I use it for young girls, and also it's much nicer and much less threatening than like photos such as this, which is much harder to understand. So let's first talk about what we're seeing here. We have the uterus, and we have the vagina and the vagina opening, and this is the cervix. We have two ovaries here, and we have two fallopian tubes here. And what happens throughout the month is that there is an egg. There are tons of eggs, which you have here in both your ovaries. You actually were, when you were still developing in your mother's womb, you had about a few million eggs. When you were already born, you had about 400,000. And throughout your lifetime, you will only use about 400 to 500 eggs. Most of them will not be fertilized. Obviously, you're not supposed to get pregnant 400 to 500 times. And they're going through a cycle each month, which I'll explain about. So what happens is that every month we have a few eggs which are starting to mature from this, from the ovary. Usually one of them, sometimes two, which will become twins, not identical twins, or even three if it will become triplets. So, but usually one egg will be released from the ovary, and it will start making its journey into the uterus. The journey will be with the fallopian tube. There's actually reports that sometimes if for some reason a woman would have a blockage in one of her fallopian tubes because of scar tissue or trauma or any other factor, so if the egg, let's say, came from here, the other fallopian tube can actually come and pick it up, which is a very nice magical thing to think about. So the egg comes here, and if a sperm will meet the egg, it will come here through the vagina and through the cervix and through the womb or the uterus, and it will travel all the way here, and it would meet the egg here, and then the sperm and the egg would become a fertilized egg, and it would take them a whole week to travel into the uterus and then latch into the uterus and create a pregnancy. If it doesn't happen and the sperm is not coming, which is what usually happens every month, the egg here will actually start dissolving after 24 hours. But there in the uterus, there is a lining of a very thick, rich layer of tissue called endometrium, which, because these cells in the uterus are called endometrium cells, so there is a very, very thick lining here that starts to grow. And it grows regardless if the sperm and the egg actually met and became a fertilized egg, because it doesn't know if an egg is going to be coming. So even if the egg, which usually is what happens every month, even if the egg dissolved after 24 hours, the uterus is still preparing, and it's preparing, and it's building. It's building such a thick layer that it actually multiplies by 10. If it started from 1 millimeter, it will actually grow into 10 millimeters, even sometimes 12 millimeters in about 2 weeks. So just think about what a huge change your body is actually going through every month. I don't know any other organ which actually multiplies by 10 in such a short amount of time. So This is the process that happens every month. The egg comes out. Usually it dissolves after 24 hours. The uterus lining starts to grow and grow and grow and grow with a very rich layer. This layer is so nourishing that there are actual research being done on this specific endometrium layers, these endometrium cells, to try to understand if they can grow organs from it or limbs from it, what is called stem cell research, because again, these are supposed to nurture life, so these are very, very rich cells. They are being fed, all these, the cells in the endometrium lining is being fed by a lot of blood vessels. And after it gets some kind of hormonal signal, which I'll explain about in a moment, these blood vessels at some point stop when they realize that the egg isn't coming. So there is a shut off of all the nutrients that are feeding this endometrium lining. And then there is a quietness for a few days. No blood vessels are pouring in. There is no growth. The endometrium layer starts to kind of shed. And that's when you start to see this brown spotting just before you get your period. Just the heaviness of the actual tissue starts to fall through your vagina. And then after a few days, after this layer of the uterus started to kind of die and crumble out, there is a sudden rush of these same blood vessels again, which pour again into the uterus, and everything starts to shed. And this is when we get our period. So you actually see that the blood of the period is not just blood, but also a lot of tissue, which used to be up to a few days ago very rich with nutrients and very rich with life energy and life force and life supporting role to it. So this is what happens every month. Okay, we have this growth time of the month, and then we have a time of the month where it suddenly quiets down, starts to die, and then there is a storm coming, washing everything again, and starts to shed this. And I'm explaining all this because I want to start moving into what is going on in our emotional level. So let's talk a little bit about the changing hormones. We have two very significant hormones which are controlling our cycle. The first one is a hormone called estrogen, and the hormone estrogen starts to rise. Let's start calling the first day of our cycle the day that we got our period. This is usually how we count it. So the hormone estrogen starts to rise up usually after we stopped getting our period. So let's say around day 7, there is a rise that starts to come up in the estrogen, and the estrogen starts to encourage the growth of the eggs in the ovary. And this time of the month we start to feel very fruitful, we start to feel very productive. Actual research have shown that this is the time of the month where we start to feel prettier, our hair looks better, our skin is more shiny. We have pheromones, which are kind of scents which we secrete outwards, which are attracting mates and potential partners. This is the time of the month where we really feel that we're in our muse. Okay, so if there's something that we need to, like a report that we need to submit for work, or an important date, or speaking in front of an audience, this is the time to be doing that. This is also the time of the month where we feel that we have more acute senses, so our sense of hearing and our sense of smell and our sense of, hearing, sense, sight, all these senses are much more acute, and we're sharper and we're more able to concentrate. So this is the estrogen time of the month, which started from day 7. Again, if we started to count our whole cycle from the day where we got our period. So around day 7, something like that, that's when the estrogen starts to rise, and it rises again more and more and more. And in the peak of it, in the top of it, is exactly the time where we feel really, really sharp. So day 10, 11, 12, that's where we're in our zone. And I really recommend that you start start documenting in your schedule and start documenting your patterns, and even start making appointments or deadlines around this time of the month, because this is where it will be the most effective. After the estrogen rises, there is what is called the LH surge. Okay, so there is another hormone that comes when it feels that the estrogen starts to come up. There is a hormone that is called LH, which suddenly surges up. So it does like zhoot, and then after 24 hours it drops. And this hormone actually tells the ovary to release the egg. So that is the time of ovulation. That is the time where the egg is released from the ovary and is being either waiting for the sperm, or after 24 hours it will dissolve. So we already had two peaks. Okay, we had the estrogen rise and fall, and then we had the LH rise and drop after 24 hours. Sometimes women report that they have some kind of spotting, which is very small spots of bleeding around this time of the month, and I'll explain in a little while why that happens, and it's very normal. After we had the estrogen and the LH, now comes the second stage of the month, which is controlled by a hormone which is called progesterone. And this hormone has almost the opposite effect than the estrogen does. If we said that during the estrogen time of the month is where we feel more nourished and alive and out there and very productive and very effective and very able to concentrate. So the progesterone time of the month is kind of the opposite. First of all, our senses ability drop. So our sense of hearing and sight and smell actually drop a little bit. Our pain threshold is much more sensitive, so we feel pain more easily, and that also might explain why we're more emotionally sensitive. Maybe we also have more, our emotional pain threshold is a little bit lower. That could also explain why this is the time of the month where we actually feel more pain. So that now is not the time to go visit a beautician and be exposed to some more pain. So the progesterone time of the month is also the time of the month where we feel a little bit more foggy in our brain. We're not as able to concentrate. We're not as sharp as we were before. Our senses are not so sharp. We feel that we kind of want to go maybe into cave mode and to be less social. We have a tendency in this time of the month, which is, again, the progesterone time of the month is after ovulation. So let's say day 15 up until we get our period, until day 25, 26, something like that. 28, it really depends on the woman. So in that time of the month, we really feel like, now we just can't handle it, and we really need to get into our cave. We're much less sociable. It's much harder for us to contain social events, to contain other people. Now is the time where we start to prepare for all this shedding. Another thing that happened during the progesterone phase is that we have an urge for what is called easy calories or quick carbs. Anything that is sweet or that contains some kind of flour or pastries. Now is the time where women have been documented that they have an urge for it. And from my own understanding, maybe it's because we're kind of like going into mama bear mode, which is ready to hibernate, and she just needs very quick carbs and needs something that is more satisfying more quickly. And if we listen to this urge, maybe it would be easier. Maybe it's something that our body actually needs, and if we only listen to this instead of making ourselves feel guilty or punishing ourselves for it, it might be easier. So as we said, we have two very distinctive and almost opposite times of the month. We have the estrogen phase, which is the beginning, starting around day 7 up until day 14. More or less, which is the estrogen time of the month, and that's the time of the month where we feel so productive and we have everything we can have everything get done, all our tasks much easier. And then we have the other second time of the month where it's more foggy. We have more of an urge to go into some kind of cave mode, to be less productive. We have this fogginess. If we learn to use our schedule and to prepare for it accordingly, it might make our lives much easier. I know sometimes it sounds like it's impossible because in our Western world we're expected to perform the same every day in our jobs or in our school and our studies. But if you think about it, the estrogen time of the month is so productive that you actually get things twice, if not 3 times, if not 4 times as much, more effective and quicker. So if I know for example, if I need to get something done, when I do it in the estrogen time of the month, I can get it done in an hour, and if I do it in the progesterone time of the month, it would take me 5 days. So eventually I think it balances itself out, and if we can learn to work with our schedule and start documenting these patterns and to start working with them and prepare accordingly, it would make our lives much more effective. So I want to start moving in to talk about what is going on there energetically. What is actually the energy behind all these waves that we're talking about? Inside our uterus are cells which are building there, and they're collecting very charged memory, like every cell that we have in our body. But as we said, because these are cells that grow up to 10 times in 2 weeks, there's a lot of accumulative memory that is building up there. And every time we're building all these memories, we have an opportunity to shed them. If these are memories in which we have a desire to release them, every month we have an opportunity to shed everything that our body has built up and doesn't need anymore, and to open a new chapter in our lives and move on into the next month. I notice in my cycle that every month I have the opportunity to reach into very deep hidden layers. Most of them are unconscious layers or subconscious layers that are buried in me, of traumas that I might have accumulated during this month, or of traumas that I might have even accumulated when I was 4 and they're still somehow stuck in there in my uterus. Sometimes these are traumas which aren't even related to me, but they're related to my mother or to my grandmother, or to just a collective female pain that has been absorbed in our earth for thousands and thousands of years. And every month I have the opportunity to go into this cave mode and to start preparing for whatever it is that needs to shed. And I do this by some kind of an emotional work that I will demonstrate in a moment, in order to start clearing the space, clearing everything that's been accumulated, either for myself or for my ancestors, which didn't have the opportunity to do it themselves, and I'm doing this for them. This is a very, very deep kind of not completely understood time of the month, where we can really channel some emotions or some hidden layers in us which we don't have usually the access to. So I really encourage you to find the time and to get into this zone. I know, again, it could sound impossible for very busy women, or for mothers especially, but I still encourage you to find the time, even take an hour or 2 hours, and to close the door, go into your cave, and start to understand what it is that you need to shed. From my own personal experience, many times it's some kind of sorrow or grief that is sitting there, and usually during the rest of the month we don't have access to it. And in this time of the month, the progesterone time of the month, because it's so kind of foggy, it allows this fogginess, allows our conscious part of the brain to kind of shut down, and then we can start exploring more hidden layers there. and to start to understand what it is that we're grieving about, or what it is that we feel sorrow about. And again, it might be some kind of trauma that I've accumulated through, let's say, sexual partners in my past. It might be the cesarean section that I went through and I still feel regret about it. It might be something that is actually of my mother's and I absorbed it through her womb. It might be something of my grandmother's, or and so on. And I really do want to encourage you to go into this every month, to go into this mode and to start releasing and shedding everything. So I'll demonstrate now which movements are helpful for us to encourage this shedding mode.